Okay, so I think we've got quite a few participants coming in. I'd like to start bang on if that's okay, so that we don't waste any time. So we'd like to welcome everyone to our fourth social care webinar by the Research Design Service South East. This is the last of 4 of our sessions that we've scheduled on social care, and I hope that everybody finds this one, fruitful in terms of impact and how to share findings. We'll also be providing some further details on other up-and-coming events in further communication from us. So today we have a presentation on dissemination and wider impact strategies in social care. And we have 2 speakers today who will be leading the session. We have Grace Collins and Sinead Palmer who will be leading. And Grace specialises in social care research, and she's based at the Personal Social Services Research Unit, or PSSRU, at the University of Kent, and she is a research officer based there. And then we've got Sinead, who's kindly stepped in, and we do welcome her into the RDS for a few months in the role of a research advisor. And Sinead also specialises in social care and based at the Personal Social Services Research Unit at the University of Kent, and she is a research officer there too. So before we begin, I'd like to let everyone know of a few housekeeping rules. So I'm sure everyone's done it, and I can see everyone's diligently done that, but just remember to mute microphones throughout the presentation, or throughout the workshop. And if your internet reception is unstable or you have poor sound quality, it's worth turning off your video to improve your internet signal. We will be recording the webinar, and it has started recording, so that it can be viewed on our website at a later date. We do appreciate any engagement and comments through the web chat function. I'm sure we're all quite used to using that on Zoom, but if you put your cursor to the bottom of the screen, you'll see a bar that comes up, and then you can add in some questions through the chat function. There'll be a break after about 20 minutes so that we can look at, so I can check up on any questions that have cropped up during the course of the first 20 minutes, and there'll be a chance to sort of share any questions or even any experiences of undertaking research and dissemination in social care. And there'll also be an opportunity to ask questions at the end. But so without further ado, it gives me great pleasure to ask Grace to commence with their joint talk. Sinead will take over in the second half. So over to you, Grace.
Thank you very much. Hello, everyone. Hopefully you can see my slides up on your screen. So I'll get right into it. So dissemination, if we look at this quote from NIHR, they define it as effective dissemination is simply about getting the findings of your research to the people who can make use of them to maximise the benefit of the research without delay. I like how they use the word simply in there, because it's not always simple, and it takes a lot of thought and planning to do the dissemination well. So the key reason for dissemination is to increase impact. But what is impact, and why is this important? So the definition by REF is an effect on, change or benefit to the economy, society, culture, public policy or services, health, the environment or quality of life beyond academia. So we're all aware of REF and the system for assessing the quality of research in UK higher education institutions. But the introduction of the impact element is a key change to research assessment in the UK. And we are now required to demonstrate the impact of research beyond academia. And it's really important for securing government funding for research. More than 1.5 billion per year of taxpayers' money goes to fund research in higher education. The funding councils and research councils need our evidence of impact so they can continue to make our case for sustained investment in research. And it also leads to accountability to the taxpayer. So the government ministers need this impact evidence so that they can justify why they're giving us this money. So funders now require a statement on impact and engagement. So if you want to get funding, you need to have thought about impact from the very beginning. And that's why today we're going to go through the presentation in two parts. So part one, I'm going to talk through the dissemination and impact throughout the project, going from beginning, and then Sinead will finish at the end. And then part two, we're going to go over some tips and advice from two dissemination and impact case studies. So part one, dissemination and impact throughout the life of the project. So we've spoken a lot about impact so far, and we've used the word dissemination, and they seem a bit interchangeable. But just to make it clearer, we're going to talk today about pathways to impact. So these can be things like dissemination, PPI, co-production, and engaging with key stakeholders. And these can all lead to your research findings being applied beyond academia, and this can then lead to impact. So just completing dissemination will not give you impact necessarily, but hopefully some of these things we're going to talk about will help you get to that final stage where you can actually demonstrate you've had impact. So considering impact and dissemination from the start. So thinking about your funding applications first and foremost. Just to note, there are some great resources online from funders like NIHR, and they talk about what they might expect. And we would say the ideal is to obviously plan your engagement and dissemination from the outset. I think it can be really clear to funders if it is a last minute thought. And I know we all think we put loads of planning into it, but hopefully if I highlight some of these examples, it might make you think a bit more in detail. So researchers who apply for funding from NIHR research programs are expected to include an engagement and impact plan in their application. This plan should outline how you engage with research users to deliver impact from your research. So things to think about are, what are the implications of your research outside of academia? So how can your findings be used by organisations and individuals in practice, and who will this affect? These are the people you want to try and engage with your impact and dissemination plan. So, and this is alongside your usual academia avenues. So if you've really thought about that and who's going to fit, then you can really plan your dissemination around that. So one way of doing this is planning your advisory group really well. So we quite often plan our stakeholder groups at the beginning, and we think about who's going to be great on it, who's going to be really help with the research. But sometimes we need to identify also the people that are going to help with dissemination and engagement. And NIHR have actually identified this as a main error in bad engagement. So they've said you need people who are deeply embedded in places where your research can make a difference, and or those who know how to make change happen. So it's not just about picking the people that know about that area of the field, but it could be non-academic connections, lay people, picking people that not only help with the research, but help with your dissemination and engagement. So having the right networks. So public people are added in, hopefully for a specific reason, not just to make the group equal, but they also not only have knowledge about hopefully what you're researching, but also the connections they may have in being able to disseminate your work. It's also advisable that getting your project advisory group on side and having them included from the outset means they're really invested in your project, and this will unintentionally probably lead to dissemination by them referring to your project outside of the group, in their own groups. So ultimately it's a version of free dissemination, and we've actually had people ask us from our project advisory groups if they can present the work that we've done at conferences on our behalf. So don't underestimate, I suppose, what they could be doing in the background. And if you want to actually take this step further, you could consider co-production. So the ESRC defines it as including people from user organisations as co-investigators. So it's conducting research with people rather than on people. And it's an iterative process of shared learning. So you're really sharing the power and responsibility from start to end of the project, and everyone benefits from being involved in it. So the one thing to point out if you do co-production though is you must request funding to meet the practical costs that incur from doing this type of thing. So paying your co-production staff and researchers extra expenses, maybe some training that they need in order to take part as part of the research team. But there is full guidance if you wanted to do something like co-production on Involve, which the website is on the screen, and I think you'll get these slides sent round. But it's not to be confused with public involvement. It's a whole nother level, but it really helps with impact because they've got the connections outside of academia as well. So also from the beginning of your funding application, you have to think of your outputs, and we try and plan your outputs as much as possible from the beginning, and this is in-depth planning as well. So the more specific you can be to the funder, the better it will look. There is classic dissemination you can do, for instance, producing booklets, slides, and this could be a viable option, but you have to justify it so that it doesn't look like you're going to a classic go-to. And the more you plan, the more you can factor in additional costs, which costs is sometimes not given enough in order to do your dissemination well. So I've said here, do not underestimate the cost of dissemination and impact. So unfortunately, it's unlikely you're going to get any good or free dissemination. You'll get word of mouth, and you could do webinars, which are relatively low cost. And you might have some really good plans for how you're going to do this, but all I would say is definitely plan all the costs that you might need in order to engage with your users, because the more you can plan for the costs, the more it looks better to the funder that you're not just putting in things that you're not actually going to implement. So things to consider for potential extra costs are things such as if you would like carers or parents to come to meetings or do work on your behalf, that you might need to consider carers and childcare allowance so that they can attend. Extra transportation costs, so there might be people that can't use trains and they might need taxis, and that's going to add up. Face-to-face meetings versus online, so sometimes online is really appropriate, and obviously at the moment it's something we have to do, most of it online. But pre-COVID, sometimes face-to-face meetings are more appropriate, or you might work with someone better if it was face-to-face, or the people you're trying to engage with don't have internet access, for instance, so face-to-face might be better. And then that could incur costs in itself, so more appropriate meeting venues. Maybe timing of meetings means you have to have it in people's lunch hours so that they can attend, and then you're offering catering so they can, so that they're being fed during their lunch hour. So it all adds up. So NIHR recommend that about 10% of your budget should be on engagement and impact. So use it wisely. Okay, so you've done your plan and the project has started. So here are some things you could do during the project. So there could be ways you could officially announce the start of your project. Is there any appropriate places for this? Organisations that will let you put it in their newsletter, online. So that's always a nice place to start. As a note, dissemination and impact doesn't always have to be at the very end of the project. So frequently at the end of projects, we're rushing around, we're trying to do reports to the funder, sometimes large reports, journal articles. So think of anything you could do during the project to save you at the end. It's good to think about at the beginning of your research and your funding application of where you may be able to create impact during the project. So for instance, is there key parts in your project that you finish and move on to the next part? This could be things like a certain methodology you've used. Would people benefit from knowing about that? Initial work packages that are finished before you move on to the next one. Even things like literature reviews. Could you get something out of that before the end of the project? You could also look for events during your project, midpoint conferences, seminars. And the good thing about disseminating early is that it seems much less overwhelming at the end. You've got a much more staggered approach. And as I said, it's not all at the end when you're really busy anyway. So also we've spoken about your project advisory group, but it's important to keep regular contact with them throughout the life of the project. This will make it easier for you and them to be heavily invested and also to actually be useful to you. When we are busy doing data collection or analysis, it's easy to forget how long you haven't been in contact with them, and sometimes 6-8 months could pass and they've heard nothing. So good and continuous communication, it doesn't have to be anything costly or heavy, so it could be newsletters, the odd email, but it will definitely keep them engaged, and they're more likely to do things for you if they feel like they're involved in the project properly. It's also great to ask them if they have any events you could attend that they know of. You can use their connections to local groups. Or for instance, if you're using local authority, they quite often have events planned throughout the year for certain groups of people, but it's important to consider this from the beginning, because some of these events, especially run by organisations and local authorities, don't happen regularly throughout the year. So they could be once or twice, in which case if it doesn't fit in at the end of your project, it might never happen. So it's good to have an idea of those, of when they are, so that you could actually use them. And social media, this is also something to do throughout the project. It's great, it's a really good and easy way to get project information out there. If a team or a member of the team has a presence already online, then it may be best to use their social media. And I would say think very wisely about websites and social media that is dedicated to the project itself. So if you have a particular website that's just on your project, because out-of-date websites or Twitter accounts can look worse than if you didn't have one at all. So they could look at your social media, realise you haven't posted for a year and wonder what you've been up to. If you can keep it updated regularly, then great. Otherwise, just have a rethink. Maybe have a hashtag instead, and it'll put less pressure on you having to update it regularly. If you do put any information out there, don't forget to make it really accessible. So infographics, is it audience appropriate? Maybe videos is better because it's not heavy text and those people can't read text on the screen very easily. Or is it easy read, or do they need it by post? So it's thinking about those small detail rather than just ticking the box that you sent something out. Actually, is it appropriate for them? And this all leads back to cost. So if you need to do videos, do you need to cost in a videographer? Or if you need it in Braille, you need to cost that in. So never forget about that. And then also Research Fish is available. So this is used by many funders and research councils to track impact of their investments. And researchers can log their outputs, outcomes, and any impacts they've had, and during the research, and for a period after the research too. So that's also a useful tool for funders. Okay, I'll just pass over to Sinead now to finish the end of the project and what to expect.
Okay, thank you. So yeah, so now you've got to the end of the project. So by now, hopefully you'll have lots of results that you can share. So again, you've got a lot of the traditional routes where you can present your findings, such as academic conferences and journal articles. But to reach a wider range of audiences, variation is really key. So you've got non-academic events and online dissemination methods that Grace mentioned earlier. But there are a few things that you want to consider when you're disseminating. So one of these is the social and political climate. So think about how your research will be perceived by different groups. Are there any risks or sensitivities that you need to be aware of? Also, you want to think about how your research can be utilised, because researchers are quite good at telling providers, commissioners, etc. what they should be doing, but not always how. So it's good to work with them to find out what would be most helpful. So whether it's within a project, testing and intervention, or whether it's providing training and support based on your findings at the end. You could think about doing a launch event for your results at the end of the project. This is quite good for addressing large groups of people about your results. You can include participants, policymakers, academics, and it's great to get a range of people in the room. We've held a couple of these for past projects, so I'll give some more details and example of all of these later. But for all of these things, you need to consider what your message from the findings is and how it fits in with your audiences. So engaging with your participant audience, so those who have taken part in the research, as well as similar others from the groups that your participants were maybe a representative sample of. So that might have been care home residents, people with long-term conditions, or anyone receiving some form of social care support. You may have instead been doing your research with staff, providers or commissioners, etc. And for those groups, they'll often have a lot of time pressures, which is something else that you'll need to consider. So you want to break down what the clear messages from your results are. So thinking, what is the main message? You don't necessarily have to give them all the research information. Liaise with your project advisory group and your PPI members as to what they think the key points are from your findings and which are the most relevant and helpful to your audiences. They can help guide what they think will be the best formats for dissemination, and I'm thinking about other accessibility considerations. And again, Grace mentioned some of these earlier, but some of these sorts of considerations might be using Braille, making documents easy read and including large fonts, or making videos. And always make sure that you're using the right language. However, again, you do need to factor in the time and resources that these will need, so don't underestimate this. Sorry, I know we keep saying this. Keep these in mind when creating all of your outputs, but also bear in mind that the NIHR say that there is an over-reliance on paper documents, and in fact they encourage creativity, and they suggest stories, social media, illustrations on their website, which Grace gave the link to at the beginning. Engaging with your other audiences, so those who haven't participated but who can still learn and benefit from the research. So you'll obviously have your academic audience, with whom some of the more traditional routes of academic conferences and journal articles will reach, but then also commissioners, voluntary sector professionals, managers, policymakers. You need to think about tailoring your outputs for these different groups, taking into account their various needs, expectations and motivations. Also, you don't have to do all of the dissemination. You might have members of your project advisory group or PPI members or research advisors who want to be involved in dissemination. And of course, if you've got your PPI or our research advisors doing this, then it's great for the public involvement aspects of the research too. It's also good to use your project advisory group and any other connections to groups or networks that you have, either existing or made through the project, to help you disseminate. So there may be events, newsletters, forums that you wouldn't have access to otherwise. You might have to think outside the box if you want good engagement, but remember that it will take time and resources. So that's the end of part one. So I think we're stopping now for questions.
Yes, I'm just looking at the chat function. I'll give people a few seconds to, if there aren't any questions to ask Grace or Sinead. I mean, I've got a question which struck me, Sinead, and that it was surprising to hear that you said that NIHR would welcome creative, non-written forms of sort of dissemination. Will you be giving us examples of that in your next part, or can you can you discuss that a little bit further?
Yeah, I mean, I think in the examples that we're actually giving, well, we've got videos. I wasn't going to show you an example, but it's more of a video from the launch event that we did.
Yeah.
But no, let me have a think about that though.
Okay.
Okay. Back to you if that's okay.
Yeah, that's well. There's quite a few questions coming up on the chat function now, so I'm going to ask Fawn Harrod to ask the question, if that's okay. I find it a bit more interactive, inviting people to ask their own questions, if that's okay.
Hello.
Hi.
Sorry, it took a minute to get the video back on then. Yeah, I was thinking quite early on when you were talking about advisory groups and making sure you've got the right people. And I was just after your opinion, really. Do you think it's better when you bring people, say, like together and you get them all to come into one space and sit around a table? Or is it good enough to just go out and have individual conversations with different people?
I think we found it quite helpful having everybody together, just because it means, you know, they can sort of bounce off each other, and then, I mean, they can speak to each other's perspectives then. So when you've got members of the public sitting there, and you've also got, you know, commissioners, people from the local authority, they can kind of, I don't know, work with each other and bounce off each other's ideas. That would be my thought on it. I don't know if Grace has any other thoughts.
No, I was going to say the same thing. So I think definitely in our previous experience, when you've had a mixture of people, they do make each other think differently. And I think it's still useful to talk to them separately, depending on, you know, what you're doing or what you want to ask them. But I just think those meetups, maybe twice a year, to get their ideas on things all together really makes a difference. And actually the interactions are great, and if you've got a really good chair that can bring everyone together, because that's the only other thing you need to be careful a tiny bit about power struggles, in terms of you get a member of the public out there, they might not feel as confident. As long as you can bring them together and they feel quite comfortable, then actually it does actually make them all think differently. Which is great for you and your research, and also how outsiders will see that and how you might tailor them what you're doing around what each of them has said differently.
And I would also add that I don't think that should stop you if you, because obviously with budgetary restraints, like Grace says, maybe you meet with them twice a year, but it might be difficult to do much more than that. So you can use your project advisory group, you know, more remotely in addition to those meetings as well, so that you can kind of get more constant involvement from them rather than just those meetings. So I think a mix of both is probably the best way.
Yeah, can I just follow up on that? And it was just to say that one of the problems we have doing care home research is a lot of care home managers are keen to have their input, but they can't always come to, say, like a central location.
Yeah.
We end up doing things one-to-one, but I'm actually hoping now more and more people are using Zoom and remote platforms. We might be able to do some work like this.
Yeah.
And bring people together online. I think that would be really useful, actually.
I think Sinead will go into this, because we actually involve care home managers in a big part of one of our dissemination case studies. And actually we found with care home managers, it's the most important thing is asking, when are you free? Yeah. And actually they all said, like, never a Monday, always at the end of the week, there. And also we actually found it in one of our previous projects, having a care home manager that wasn't involved in the project as well, so that their only commitment, I suppose, was to the project advisory group.
Right, that's a good idea.
I don't know if that might be helpful.
Yeah, definitely. Thank you.
Thank you. There's a question from Sabina. Sabina, would you like to?
Yes, hi, thanks. Yeah, the question is, it's you know, sort of is specific. If there are any, you know, sort of specific sources for funding for dissemination and impact, when these are not included in the original bid, and not sure who all the participants today are. The reason why I'm asking is because at the moment I am struggling to actually, as an RDS advisor, to find such funding opportunities. opportunities for a specific project that had a bit of cost for dissemination, but actually now they have such ambitious ideas that they want another chunk of money, and where do we go at that point?
Well, we did actually get, in fact I'm going to be talking about it a bit later, but Grace applied for a bit of money for one of our previous projects for one of the launch studies events that we did. Grace, would you remember what
Yeah, that was directly through we went through our university actually, because they were interested in providing money towards that, and we applied for it and got it. I personally don't know any funding that focuses, apart from some niche small bits, and potentially through university or through funders directly, whether there's large amounts of money that they give just to dissemination. Only because I don't know if a lot will see it as it should have been included. I know that's all in hindsight, and also there's not always the money there, and quite often dissemination bits of funding are the first to be cut to get you under the funding amount potentially. So I don't know if it's something we can share amongst the group, if anyone's found any niche funding available for directly just dissemination and impact.
That'd be very useful. If anybody thinks about it later on. As I said, I'm sure that if the people I'm working with, are here as well, because I can't see the whole list, they'll appreciate, basically. All right, thanks. Thanks,
Sabina. And the last question from Rebecca Sharp. Is that all right for you to ask a question?
Yeah, so hi everybody. Just to follow up on the previous question actually, and I wonder if there's something that maybe the ARC KSS, so I'm from the ARC Social Care Implementation Lead, and whilst we haven't got pots of funding, but it may be something around, part of my role is implementation and dissemination of research in social care. So really happy, Sabina, to have a conversation with you and sort of talk about the social care theme within the ARC and whether that's something we can support around implementation.
I've sent an email to Mel yesterday and then rerouted it through the general inbox just for that, so maybe I can do you want to I'll send you my email address and just send it through me, and I can sort of pick that up and have a look. And then my other question on this, you'll see there, is about restrictions around sort of early dissemination, and whether there is restrictions around that prior to sort of any final reports and fundings. I'd be interested to hear if there's any thoughts on that too.
Yeah, there is some, depending on your funding application, there sometimes is restrictions or 30-day rules where you have to give them warning. Some ways we have got around that is things like presenting on your methodology. So because it's not actually results, it's fine to do. And especially if you've used not a niche way, but co-production, or we've done presentations before of how we've actually engaged with care home managers and how to recruit them. So it wasn't always about results. But it depends on your research question, I suppose, and what you've done to see if there's anything where actually people would find that really beneficial if I told them about before.
So it's sort of socialising the research in a way early, but you're not actually giving the results or the findings from it, but more talking about the process that you've gone through in actually carrying out the research.
And I think as well with other projects, if we were planning on doing dissemination, or say writing an article of what we've done halfway through because we got to a point we could, also putting it in the funding application meant we had support for that before we rather than you deciding 6 months in, actually this is a good idea. That might be a bit harder, and you'd have to speak to your funder about that. But we've done that before, haven't we, Sinead, where we've planned it in a shared lives project and written an article before it was finished, I suppose.
Thanks, thank you.
I think Anne-Marie just wants to come in and add to the response to that question, if that's okay.
Hi everyone, sorry I had to unmute myself. All I was going to say was two things coming out of that. One is that if you've got an existing project and you have more ground plans for dissemination that haven't been written into the original proposal, I'm sure this has already been said, but go back to your funder and double check with them, because sometimes they will release extra money, particularly if it's relatively small but will have a clear gain, clear benefits, dissemination impact. The other thing is that, to go back to Rebecca's comment just now, sometimes you can run these sort of launch events or feedback events before the final report deliberately, because what you're trying to do is you're trying to engage wider stakeholders and think about how they might comment and feed in and help you understand your findings. So actually you can use a kind of dissemination event as a mechanism for engaging, so it's a two-way conversation. So, and funders actually, I think, find that quite attractive, because by the time they get the final report, it's also then been informed maybe by feedback from the sector, from the very people you're trying to produce those findings for. So just a couple of extra very quick comments on that.
Thanks.
Thank you, Anne-Marie. But without further ado, it's over to, is it Sinead? You're going to be
me, yeah.
Okay, so take the floor, go ahead.
Lovely, thank you. Okay, so I'm going to start part 2 now, which is going to be some case studies and examples of the impact and dissemination strategies that we've used in the past. So the first one is the Measuring Outcomes of Care Homes project, or MOOCH, which was an NIHR SSCR funded study that ran from 2015 to 2018. The project was looking at the quality of life of care home residents and the relationship of this with the care homes CQC ratings. So as the funder requires a breakdown at the application stage of the proposed knowledge and exchange activities and the pathways to impact, these were the planned activities that we had for MOOCH. So these included writing articles for a practice-based journal article plus academic articles, adding to the ASCOT toolkit, which is available online for use by providers, academics, local authorities, commissioners, etc. And back in 2015, when we proposed this, there were 1,200 registered users of the website. We were planning to do finding reports for homes so that they could see evidence-based examples of where the homes were doing really well at meeting residents' needs, as well as other areas that needed some improvement. Links with CQC, where we had a representative in our project advisory group, and they also helped recruitment. Social media output, so blogs and Twitter throughout the lifespan of the project. Academic and non-academic conferences and events such as the British Society of Gerontology and the Margaret Butterworth Care Home Forum, and a launch event, which I'll talk more about in a moment. First of all, we wanted to think about who the research could affect. And these were the groups that we thought that the research would impact on, from the residents themselves, who could have their quality of life improved, or their family members using CQC reports to help choose a care home, to local authorities or commissioners using the toolkit to monitor services, or managers using the findings to improve their homes. So these are the people we had in mind when we were planning our impact and dissemination strategies. So we held a launch event at the end of the project for MOOCH, and this was to try and reach a range of people, and it was one of our dissemination activities. There were a number of considerations that we had to think through in order to make it as useful as possible to those attending and to get our message out. So we held the event at a location that was chosen as it was fairly central, as all the care homes involved come from 2 neighbouring local authorities. So we wanted to try and make sure that nobody had to travel too far. We also made sure that the venue was accessible, as we had several residents attending who had mobility needs. The event was held in the afternoon, so people had time to organise themselves in the morning, for example, get residents ready, and other people attending only had to take off half a day from work where that was applicable. Held at the end of the week, because as we mentioned, we were advised that Mondays is really busy for care home managers, so far too difficult to come and attend an event. We created nice looking invitations that we sent through the post, and we invited care home managers to speak and to share their experiences of taking part in the research, because they were also really important in sharing the research amongst the care home managers in their circles. So for the actual launch event, we invited a long list of people, including residents who'd participated, care home representatives, a local MP, NIHR, I don't know if NIHR, the Research Ready Care Homes Network. We invited the funders, CQC, Kent and Medway local authority representatives, the NIHR, and our PPI members. So we use the project advisory group to help us come up with the invite list, and we use their connections to access people that they thought would be interested. We applied for an additional pot of funding, as we just mentioned, to enable us to make the event as accessible as possible, which included paying for the transport costs for the residents to attend, as well as paying the care staff to support them. We also used the money to hire a videographer so that we would have videos of the event to share with those who weren't able to attend, and so that care home staff could show staff and residents. So the videos are hosted on the PSSRU YouTube account, and if you are interested, you can use the link and you can find a bit more about us talking about the research. So what went well from the launch event? Well, it was really well attended. We got a lot of people there, which was really good, and it was really interactive. It was a really interactive session, and care home residents were really involved in the discussions. The care home staff said that they found it really interesting and something that they hadn't done before. We got the videos from the videographer, which we can use for future use, and we can share. We got great feedback from the funder as well, and also several homes that had participated signed up to the NIHR network following our Mooch project, which is great because it means now we've got more potential participants for future research projects. Okay, so the second case study, which was the Shared Lives Evidence Effectiveness Project, or SLE. This was another NIHR SSCR funded study, which again ran from 2015 to 2018. So we worked with shared lives schemes, where shared lives is a community-based form of support where a person either lives with or has regular visits to their shared lives carer's house. And the study focused on adults with learning disabilities, older adults, adults with mental health problems, and adults with a physical disability, looking at their experiences of the scheme and whether it provided value for money. So the proposed knowledge exchange activities and pathway to impact for this study included journal articles and conference presentations, workshops with non-academic partners, publications for non-specialised audiences. We had a project website. The study was promoted and the results were disseminated through Shared Lives Plus, which is the umbrella organisation for Shared Lives. We did another launch event, and we used co-researchers, which is what I'm going to be highlighting in this case study. So these were the groups that we thought the research would affect from this study. Where we thought there could be those involved in the schemes, either as service users or carers, local authorities and commissioners who want to see the value of the scheme, as well as Shared Lives, the umbrella organisation, Shared Lives Plus, who are keen to maintain a good service in all their schemes. It could also affect the funders, as the growing research base on Shared Lives leads to its inclusion in further funding calls. So I'm going to talk a bit about the co-research element of the project and how it factored into our dissemination and impact strategy. So we recruited 3 co-researchers to the project. These were people who had experience themselves of being in a Shared Lives arrangement, and they were recruited for us by Shared Lives Plus. They were paid for taking part in training and meetings, as well as all the field work and all the office-based work that they carried out, plus the travel costs. They were active members of the research team, and they took part in a number of research activities, including preparing the interview schedules, interviewing other users of Shared Lives, helping with the analysis and writing the report. So we found that having their input into the interview schedules and analysis really helped make our research more relevant to the user groups that we wanted to impact on. And they were also really significantly involved in our dissemination strategy. They had a lot of input into the types of outputs that they thought would be appropriate for users of shared lives, including helping us make documents more easy read, and they suggested using videos to supplement paper reports. I think that this input really helped us reach our audience more effectively. They also presented at the annual NIHR SSCR conference. So they chose what to present, and what they wanted to do was their experience of being co-researchers. And it wasn't, so this wasn't at the end of the project. This was towards the end, I think. And they gave their view on being involved. The presentation was really well attended, and the co-researchers were given a lot of really positive feedback. So I've got a little extract from one of the presentations of our co-researchers, and I think it highlights both the possible impact of the research on the participants and the co-researchers. So one of our co-researchers said that it was better for them, when talking about the interviewing that they were doing, it was better for them to be interviewed by us because they can see we are like them. If they get interviewed just by professionals, it can be worrying and frightening and scary, like having a review or something. To have it from someone like me, I think helped them to speak up more. I think as well that people seeing people like us doing a job like this, they absolutely made them feel more confident in what they could do too. So the potential impact on the participants was that it elicited more information and helps them have a say in the care that they receive. And the impact on the co-researchers was that it helped build independence and confidence. Our co-researchers said that they learned new skills and they had a real keenness to do more research after taking part in this. So we're really hoping to be working with them as co-investigators in future projects. Okay, so I think the takeaway messages from all of what myself and Grace have said today really are: don't wait until the end. As Grace showed you, there are so many things that you need to be doing from the beginning to plan it all in, plan in all the funding and the resources that you'll be needing from the beginning, all the activities that you want to be doing, making sure that you've planned in enough time and funding to do all of that. Use the whole team, including the project advisory group and all of their connections, all of their networks, to be the most effective, and try and think outside the box. So those are all my points. Thank you for listening. I think we've got some time for some more questions now.
Thank you very much, Sinead, for finishing off, and thank you to Grace as well. Before we talk about your last slide, I'd like to highlight that I think we'd take some questions. I think there's one from Brian. Brian, would you like to unmute your microphone or come to and show your camera and ask your question?
Hello.
Hello.
Hello, sorry. Yeah, I'm fiddling with buttons there. Well, the question there, you mentioned a pot of money that you got for dissemination. Well, first question, you mentioned a pot of money for the dissemination event. Do you see where you got that? Is that available to other people trying to make these impact dissemination endeavours?
I think what Grace mentioned, I think it was a university pot of money. So we applied to the University of Kent. I think they had an additional call. Grace, can you remember what it was called?
No, I can't remember. I think it was just a public engagement fund.
Oh, yeah.
Then they had a small pot of money that they could give to people.
Right. Okay. Okay. Yeah, I just want to. We were working for RDS. Whether you know, we have the PIF fund, which is about engaging with PPI. You know, wonder what we could do. We should be looking at, you know, some small fund anyway for that. You know, either during the research or after research engagement. Anyway, it's something for us to think about. The second question is: have you evaluated the dissemination efforts, impact efforts? Is that something you plan to do?
We haven't done as of yet. We were planning on doing a full one on SLE, but we never got round to it.
Right. Yeah, I mean, I quite agree with all the inputs and, you know, as it were, exercises and activities involved. And I guess we're asked, you know, coming from that realist point of view, what worked for whom and what circumstances and why? What are the, you know, what the underlying context and mechanisms that make effective dissemination impact? Yeah, that we could all learn from.
No, I think that's a really good idea, and I think it's something that we will need to be, we should be really doing. Learn from that.
Oh, thank you.
Thank you, Brian, for your question. Are there any other questions? We've got a few minutes for questions from anyone else. Well, whilst you may be thinking about any questions, I would like to flag up, we have, as I mentioned earlier, this is the end of our social care webinars, but we do have some other events focused around social care coming up. So we have an RDS research for social care workshop on the 16th, and I'm hoping that people there, you know, there's enough interest generated to be able to sign up to that as well. And I expect that some of the topics and themes that Grace and Sinead spoke about today will certainly feed into the research for social care funding application if any of you are interested in that. And then there's another more of a general NIHR research programs workshop that we have on the 7th of October. And so do also look out for any further information about signing up to that one or the earlier event that I spoke about. And we also have, you know, for those other RDS advisors, we also offer a service where we have 1 hour slots where you can talk to advisors, and these are available most weeks between September to December, where you can talk about your research project idea, even you know, in a very fairly early stage. You know, we'll certainly welcome talking about your research ideas with you. Do look out for our project development sessions or contact us, and do look out for our outreach events. So if there aren't any further questions from anyone, I don't think there is. So I'm quite happy to wrap up today, if that's okay with Grace and Sinead.
Yeah.
I'd like to thank you both.
Thank you.
Thank you.
Talking through your, you know, very imaginative ideas about, you know, how to involve, how to have a wider impact in social care research dissemination. And you know, it's really great to have Sinead as well, who is a research advisor with her expertise in social care. So you know, sort of, it's a win-win for us. Okay, well, thank you everyone. I think it's time to wrap up, and hopefully you enjoy the rest of your afternoon with some surprise sunshine.
Thanks,
Thank
everyone.
you, everyone.